Hi, my name is Dr. Marty Nager, and I'm a board-certified periodontist. You may have been referred to a periodontist by your general dentist, a family member, or friend. This video will demonstrate what happens during a periodontal examination and consultation. What I'd like to do now is to explain to you a little bit about periodontal disease in general, and then I can be a little bit more specific about the numbers from your mouth. Everybody has plaque in their mouths. Whether you eat, whether you drink, whether you smoke, doesn't make a difference, although smoking makes the gum disease worse. Plaque is made up of your own saliva and millions of bacteria. Of all the bacteria that are in the plaque, there are two types that we worry about. One type produces an acid, the other type produces a poison. The acid eats away at the tooth and causes a cavity. The poison eats away at the bone around the tooth and causes infection of the gum around the tooth. Perio means around, dontal means tooth, so periodontal disease is disease around the tooth, which is the gum and the bone. Nothing to do with cavities, nothing to do with root canals, nothing to do with crowns, they're totally separate. So what you felt me doing was I took my little probe here, which is just a millimeter ruler, and I stuck it in between the gum and the tooth to walk it around and try and find out how far underneath the gum I could get the probe, because that gives me an idea of where the bone level is. Any of the numbers that are 3 or less are fine. Anything over 3 is a problem, which we'll talk about. So on the healthy side of the model, where there's no problem, the probing depths would be as follows: 333, 333, 333, 333. If I can peel the gum back and show you what you can't see behind there, that white stuff right there is the jawbone, right here. It's the function of the bone to keep the teeth in your mouth. It's the function of the gum to attach to the teeth and to seal tightly around the teeth to protect the bone from the plaque up here. The plaque builds up and grows. It grows down underneath the gum where it breaks the seal of the gum to the tooth, crawls down below and behind the gum where you can no longer get to it. So even though you brush your teeth every day, you brush above the gum, and when you get your teeth cleaned, they clean above the gum and below the gum to level 3, but deeper than that they can't get to. So we go from that side of the model to this side of the model where everybody's happy, feels fine, there's no pain, no problem, but now the probe goes in deeper and that tells me there's been some bone damage. So this would be 545, 556, 6, 7, 8. If the probe goes in that far under the gum, the only way that could happen is if there's been some bone loss. So again, let me peel the gum back and show you that's the bone damage that occurs by those bacteria chewing up the bone around the teeth. That causes the teeth to become loose. In fact, on the model here, this tooth is so loose it's going to have to be removed, even though there's nothing wrong with the tooth. No cavities, root canals, fillings, it's a good tooth, but the bone has been destroyed. When all the bone is destroyed, your teeth come out, you wear a denture, and then there's no more periodontal disease. We call the area in between the gum and the tooth the pocket. The bottom of that pocket is where the bone is. And the bacteria have caused bone damage all the way down to wherever the level is that's remaining. And unless we are able to get in there all the way down under the gum to remove the bacteria and the plaque from underneath there, the disease will just keep progressing. So what you need to do is you need to come back here for 4 visits, 1 for each quarter of your mouth at a time. You'll come in and we will get you completely numb so that you have no pain whatsoever. Once you're numb, we will be able to get our instruments way up underneath the gum tissue to scrape all of the plaque and the tartar and all the junk off the root surfaces. Since that's what's causing the gum infection and the gums to be fairly large, removing them will shrink the gums back up again, and then you'll come back and see me for a reevaluation, which is an appointment similar to today, after your whole mouth has been completed. Either way, once this treatment is done, you have to make a commitment for excellent daily home care, as well as getting your teeth cleaned every 3 months, which is 4 times a year for the rest of your life. You're someone who will now have a general dentist and a periodontist. That way we'll be able to take care of you and hopefully help you keep your teeth for a lifetime.